Rosacea is a kind of skin condition that has relapses and remission, in which we typically see there is a central redness of the cheeks. Sometimes it comes, it goes, sometimes it is associated with pimple-like lesions, sometimes with the thickness of the skin. The first and most common one is sun exposure. Even a mild sun exposure can trigger it. Then the kind of food intake you have, spicy food, your beverages like hot teas, hot coffees, alcohol, even your strenuous exercise, they can trigger your rosacea, or you are having just an emotional stress, even that can trigger your rosacea. Rosacea is quite common. It's more common in Western population, but yeah, we can't say that it's uncommon in India. We frequently see rosacea people in our routine OPD, and plus we have a special condition which is called steroid-induced rosacea, which is more common because of overabuse of steroid, which we get on over-the-counter drugs. That's another kind of rosacea which we commonly get. We are having different stages of rosacea. For initially, patient gets a transient erythema, a kind of flush that comes on your cheek and goes. Then a point comes that it becomes persistent. Your center of cheeks are red throughout the day, and then after a point you get tiny lesions like pimples over your cheeks, and if it's very prolonged and ignored, then your skin over that areas it becomes thick. Main is redness and flushing. Even the small things like you just went out for a few seconds in sun, your face has turned red, you are getting itchy red bumps, and sometimes very prolonged it leads to disfigurement of your face. Yeah, like you have a very thick nose, a very thick chin. The prominent areas they are becoming very thick, ugly looking textures. Besides the redness. See, rosacea for some people it's just inherent factors. You are born with an abnormal sensitivity. So there are certain triggers like exposure to sun or your spicy food or your alcohol. These small triggers normally people don't react to it. But your nervous system, your nerve supplies to your blood vessels, they are somehow abnormally reacting to such things. So they become suddenly dilated, inflamed, swollen, and you get such kind of skin changes. And sometimes we say there is impaired skin barrier. Normal the skin, it acts as like a strong door, it's closed. It doesn't let something to in and out. It protects you from any kind of stimuli. Maybe your barrier is weak, or the normal microbiome, the normal, you can say microorganism on your skin, which helps to maintain a normal environment, maybe that is altered. So there are multiple factors, but the main one is abnormal reactivity of your, you can say, nerve cells to your blood vessels. Usually the young adults, they are more prone for it. Those who are indulging in excessive activities like very strenuous exercise or over consuming alcohols, cigarettes, those who are mountaineering where UV index is very high, they easily get such kind of conditions. Or usually people who are living on the hill station areas with a very light skin texture, the darker your skin is, creates a kind of skin barrier. So those who have a very light skin complexion, they are fair. They are more to have those kind of skin changes. There, the UV radiation, they easily penetrate your skin. The other skin condition which can be commonly confused with rosacea are seborrheic dermatitis or acne. Seborrheic dermatitis is a kind of eczema. In that we get the redness, but with the redness we have a kind of greasy white, greasy yellow scales, predominantly over your nasal ala, center of cheek. It also includes your eyebrows. It's a very itchy condition and it has a seasonal variation. We get it more during winters, even when we are not exposed to the sun. And there is a kind of stretchy feeling, a kind of dryness over the face. So that is an eczematous condition which we differentiate in, and other one is acne. In acne, we get tiny bumps, and there is no transient flushing, your redness coming or going, and there are characteristic comedions, which you can say the blackheads. They are seen in acne, and they are not seen in rosacea. Rosacea is more of a clinical diagnosis. The typical symptoms and when we examine your skin, the red skin with prominent blood vessels, the thinning of the skin, and the red lesions we get, and the typically thickening of the skin over the nose, over the chin, central of the cheek. It's more of a clinical diagnosis, but sometimes if we are having any confusion, then we go for the biopsy, which shows us the typical histopathological changes. Home remedies are to soothe the skin. They don't treat your rosacea, but yeah, the soothing agents like aloe vera and other soothing gels, they can give you a temporary relief. But for a cure, you need to take a proper medication. I would advise you to see your doctor. There are many over-the-counter drugs, but they are, and on long term, they instead of giving you a cure, they create a kind of resistance. My advice will be see your doctor, use soothing agents, but proper line of treatment is more important. First and foremost is use of sunscreen, as UV radiation are a good trigger. So a judicious amount of sunscreen application before you go out and repeating it every 3 hours is very important. Number two, avoid drinks, hot drinks, spicy foods. They are very important. If you are into vigorous workout, I would advise you to go for low intensity workouts. So these are the minor changes that helps you a lot.